In 2008, I was diagnosed with non-Hodgkin's lymphoma, and I was being treated up in Sioux City, where I went to school. I had just graduated nursing school right when I got sick. We had heard a lot about the Med Center and knew it was the place to come, and we were only an hour and a half away, which made it absolutely the #1 choice for us. It was amazing. Have nothing but good things to say about the care I received here. Just of how the care is here, I just thought someday I really want to be a part of that. I first started out as a staff nurse on the OSHU here at the Med Center, and when a lymphoma transplant coordinator position came open, I thought, why not try for it? And I got it and couldn't be happier. I think that's one of our top goals here, is to just make sure that every patient and their family feel like they're being well taken care of, and that they're very important, and that this is the most serious time in their life. And I feel like that's where our serious medicine extraordinary care comes into play. I definitely like to let patients know that there's hope on the other side, and you can have a quote-unquote normal life again after cancer. Because when you're the patient and you're going through something like that, that's really all you're striving for, is to know that I can get through this and there's hope on the other side. I'm a faithful person, so to me in life everything happens for a reason, and I feel like I was given this horrible disease for a reason, and to help others through it. I'm at my 5-year point right now in remission, and I can honestly say I owe it all to God and the University of Nebraska Medical Center.
I enjoy seeing the people grow up and go to school and go to college and get married and have children and have grandchildren, and I don't think that would have been the case without this form of treatment. I would have never dreamed that we would do outpatient transplants. I would never have dreamed that we've done roughly 4,500 transplants. I didn't know that we would be doing this 30 years later. For Hodgkin lymphoma and non-Hodgkin lymphoma, we're a lot better than we used to be, and so fewer people need a transplant. I think it's our wish that we don't have to do transplants in the future. I think as we get better with our initial therapy and with our new drugs, I'm hopeful that people won't relapse and they won't have to have transplants in the future.
And we have a great team here that when the patients come in, we evaluate them very quickly. We're fortunate to be able to have excellent pathology to be able to give us the answer of what type of problem they have, be able to have access to all kinds of new treatments, and get the patients on the road to recovery in a very fast time. The future holds for us is to try to take the research that we've used and developed over the past several years and to develop that into new therapies for patients. So based upon our research, a lot of the information is now being used to develop new therapies for patients, and a lot of those therapies are based upon pathways of cells so that we can target those cells just by medications that are against the lymphoma and not against the normal tissues, so that there's less side effects for patients, and that's really where a lot of our research is going.
The future is really to understand the details of what drives each individual cancer, and then to work with scientists to understand what that information really means, and then physicians to develop the precise treatment for each individual patient. The cancer complex will in itself be transformational for the hospital and the university, because it is the first integrated project that we've really had together, where patients, clinicians, nurses, pharmacists, and researchers are all located in one facility. And the future of all medicine, as we understand it, is going to require this integration of the science of medicine and the care of medicine.
I've had the opportunity or even the privilege to talk to families, to work with families, to visit them across the country. And they've come to Omaha, Nebraska, and they talk about these milestones, and they may be maybe a 1-year or a 2-year or a 5-year or a 10-year, or it may be a child's graduation or a wedding or a grandchild or even their own child that they were told and thought they probably would never have. These milestones are celebrations for them. Hearing from those people when they are experiencing their own milestone and they want to celebrate it somehow. They do that, but they never forget, and they never they fail to forget that it's some of this work that's being done day to day in labs 6 and 7 days a week that is going to make a different type of hope for somebody else in the future. When they leave Omaha, Omaha doesn't leave them. they stay with us and they stay with the program and they continue to say, I want to help in a way that will touch the life of somebody I'll never know. Hundreds of people, thousands of people that they'll never know. The more people we have energized and with us, the more great work we're doing. This is just about helping them do something that feels right, feels good to them, and is of personal meaning to them. And that could be going online and very privately making a small contribution, or it could be calling myself or someone else or talking to their doctor or case manager and say, how can I help? You know, I would like to help.